Hello students, welcome to the class of Health and Physical Education, Unit 10, Training and Doping in Sports, and today's topic which we are going to learn, that is prohibited substances. We have already learned related to the performance enhancing drugs. We have learned related to the physical method which the athlete or the players use to dope. We are going to learn related to the prohibited substances. Now, what are the prohibited substances? Prohibited substance and the methods are those substances and methods which are completely banned in sports and games. So actually these methods are those methods or prohibited substance, and these methods like doping, blood doping, gene doping, these are the methods. And prohibited substance, we are having various types of drugs. So these are being used, these are the substances which are being used by the athletes or the player, which has been completely banned in the sports and games. Now, according to the World Anti-Doping Agency is responsible for maintaining and updating these substances and method annually, because annually, that is every year, they used to maintain and update these substances. Some of these what the World Anti-Doping Agency they used to make, that they used to find out that what are the types of substances which are being found out in a player, those who have doped. And according to that, they used to find out whether these substances which the athlete have taken, whether that is going to give the athlete more advantage, and whether it is also going to affect their health in future. So they are going to ban these substances. So that's why they used to, it has been written that the maintaining and updation of the substances and the methods annually. Some of these substances are banned at the time of competition, whereas other substances depend on the tablet, injections or breathing. So here it is being told that during the competition some of the substances are banned, because there are the various drugs, there are the various types of medicines which are being also applicable for the patients. It is not to be taken by the athlete or the competitors during the games or sports competition. But that's why it has been given that some of the substances are being banned at the time of competitions. So whereas the other substances depend on the tablet, injections and breathing, these substances are included in the list of prohibited substances which enhances the performance of any player or harm the player's health or violate the spirit of the sports and games. So here it is being told that there are the substances which are being included in the list of prohibited substances. It is being clearly told that these are the substances which are being prohibited for the sports and games, because these substance, the person who used to take this substance, the athlete or the competitor who used to take these substances, they may enhances their performance, they may increase their performance, or it may also, these substance also harms the player, as well it also violates the spirit of the sports and games. So if the player takes these substances for the treatment or therapeutic use, he will have to apply to the International Federation for exemption. So many times it happens that these substances, that many of these medicines or the drugs which are being taken in the form of tablets or injections, which are being used for the treatments of the player as well as for the therapeutic use also, will be they have to apply, those who are using these drugs or they are using for their betterment or for the therapeutic use, that is as a medicinal purpose, then they need to take the permission from the International Federation for the exemption, and it must be verified by the physical in order to get an approved. Here are the following points. So here it is being told that it must be verified by the International Federation that I am taking this, and for what purpose I am taking these medicines or drugs or the tablets or injections, they need to inform. I am talking about only those banned substances. Clear? So let's learn one by one. So that's why it is being taken by the player. So let's learn one by one. So we are having first is drugs. So some narcotics such as fentanyl, morphine and oxydone are prohibited in competition. So these are the drugs. You can find out the names like morphine, fentanyl as well as oxydone. These are prohibited in competition. During the competition it is being prohibited. These substances are also banned because these substances interface with the functions of estrogen or female hormones and often used in the treatment of cancer. So these are the medicines or these are the drugs which are being used for the treatment of cancer. So but for the competitors it has been it has been totally been banned, and that's why it is being considered as in if the any of the competitor or athlete, if they used to take such drug, then it is being considered as in they have doped. So it is being only used for medicinal purpose. For what? It is for the treatment of the cancer. The examples of the tamoxifen and clomiphene, these are the examples, these are the medicines, are being given the names of the medicines. You need to remind few, you need to remind, it may be difficult for you to remind, but few of this you need to remind it that these are being included in the drugs. Second, we are having beta 2 agonist. Now this medicine is been mostly been used for the treating the asthma patient, but for the competitor it has been totally been banned. So these drugs are banned during the competition and even after the competition, but actually it is not been applicable for the player. These medicines or these of the drugs are not been applicable for the players because they are healthy. Because what happened, they want to, these players, they used to increase their efficiency of the breathing system. When the breathing system efficiency increases, the RBC level also increases, the oxygen carrier, the RBC used to carry the oxygen, that also increases. So that's why it has been totally been banned for the players. It is after the competition also and during the competition, but it is only been used for the treatment of the asthmatic patients. Clear? It is not for the athletes. So this is also been considered, it is been banned for the players. Then we are having the stimulants. The stimulants such as amphetamine, then we are having ephedra and cocaine are being prohibited in the competition, but it is also included in the monitoring program. It is being used for the monitoring program on the patient. These stimulants improve the performance in the sports by stimulating the mind and the body artificially. This is an artificial. These are the medicine, amphetamine, ephedra as well as cocaine. These are the types of drugs or stimulants. It has been considered as stimulants because all are not drugs. Drugs we have learned related to the drugs. These are the stimulants. So actually what these stimulants used to do, that used to improve the performance in the sports by stimulating the mind and the body artificially. The mind totally gets relaxed, the body used to get charged up, and it is an artificial way, not natural way that you used to improve. It is an artificial way, so that is going to harm the player also in future. But for that time period, no doubt that they are going to perform well. So that is why these are the prohibited in competition. So stimulants are also being prohibited in competitions. Then fourth, we are having anabolic steroids. You have seen that many of the players, they used to take the anabolic steroids. So anabolic steroids such as drostanolone, then masterolone and oxandrolone. And we are having tetrahydrogestomonol, that is known as an THG, and strenozole, and are prohibited in and out of competition. These are the types of medicines. These are the anabolic steroids. Actually, these are the steroids which are been totally been prohibited in and out of competition. Either during the competition or after the competition, it has been totally been banned. These are the prohibited because I hope so that these names you might not be able to remember, but one or two you need to remind. These are the prohibited because they enhances the performance and has a serious side effect on the player, because at the time of tournament, no doubt that their performance is going to they are going to perform better, but they are having these anabolic steroids are having a side effects. It increases the blood pressure, it harms the liver, shivering, heartbeat increases. Female tends to adopt the male qualities such as growth of the hair on the face. That means that female are they are having a type of muscular type of structure. That means that they may also find out the hairs on their body, on the faces. So these are the harmful effects of this anabolic steroid, and that is also going to cause the death in future due to the heart attack, and that also the person may suffer from death. Then next we are having, that is diuretics. So diuretics, the names are being given: dextran, diuretics, and probenecid, etc. Due lines the presence of the prohibited substance in the urine. You may find out that during with the help of the urine sample, they used to find out these drugs are being banned in and out of competition. Diuretics are being banned for the competition because mostly these diuretics are being applicable for the events like where the events are being related to the weight category, like wrestling, boxing, weightlifting. So for that, the diuretics, the person, the athlete, they used to dope by taking these diuretics, dextran and that all. So this is also considered as a banned drug, or it has been considered one of the prohibited, banned, prohibited substance. Then sixth we are having, that is peptide hormones. Peptide hormones such as erythropoietin, that is RBCs related to that, human growth hormones, insulin, human chronic gonadotrophic hormones. Then we are having, that is HCG. Then adrenocorticotropic hormones, etc., are being banned hormones. These drugs increases the power and the strength of the muscle. See, you need to remind here that what type of prohibited substance and what are their effects. Like for example, diuretics, it has been applicable due to the weight loss. The person used to weight loss with the help of the diuretics. Peptide hormones, what is the function of the peptide hormone? That used to increase the power and the strength of the muscle, and also enhances the RBC level. And as the RBC increases, so intake of the oxygen capacity, the blood carrying the oxygen will also increase, and definitely the performance of an individual increases. So you need to remind these functions, name of this type of their hormones. You may remind one or two, but rest of other you need to remind it. These drugs increases the power and the strength of the muscle, and also enhances the level of the RBCs. The red blood cells increases, which increases the capacity of the blood to carry the oxygen. Maximum oxygen has been carried. If the RBCs are more, so oxygen level in that person or in that athlete will also be more, and this is going to increase their performance, and they are not going to exhaust soon, so they will be having a good endurance also. So these drugs are being banned in and out of competition. So these are being peptide hormone is also one of the substance which has been banned. Then we are having the alcohol. You know that this alcohol, that ethanol, is been prohibited in competition only. You have seen that many of the person, they used to drink, they used to take as a drink, but for the competition, for the competitor during the competition, it is not been allowed. Actually, it has been totally been banned. That's why it has been totally been here written that alcohol, it is been prohibited in competitions only. It is very clearly mentioned. Then afterwards it's okay, but during the competition, because it used to relaxes the mind, actually they are not being able, they should not be taken, they should not be able to take the part in the competition, those who have drunk. Then next we are having beta blockers. See, these beta blockers are prohibited in the competitions only, such as archery, shooting and golf. In fact, they keep the heart rate low and reduces the tremblance in the hand. So here you can see that it improves the focus. See, these are the games which used to improve the focus. So beta blockers is also been prohibited. This is also the substance which has been banned. So that use beta blocker. What does the beta blocker used to do? They used to they used to calm your mind. Actually, they used to calm your heart rate also. The heart rate becomes low, reduces the tremblance in the hand. There you may not find out any shivering in your hands if you used to take this beta blocker. So they used to practice with the such types of drugs. Then we are having glucocorticosteroid. These are being used mainly to relieve pain. If any of the person, those who are having the pain, we already learned this related to the glucocorticosteroid, because in order to reduce the pain, if a person is suffering from any of the pain and if they want to perform during the competition, then they used to dope by taking such types of substances, prohibited substances like glucocorticosteroid, which used to relieve the pain, and these are being prohibited in the competitions. So these are the substances, prohibited substances we have learned. I hope so that you may remind this, that which are the prohibited substances and what are their functions, and where in which of these games are being used, and what they used to do. Clear? So I hope so that these are the clear. So once again, just let's remind the name. We are having the types of prohibited substances. Clear? The prohibited substance like drugs, beta 2 agonist, stimulants, anabolic steroids, diuretics, peptide hormones, then alcohol, beta blocker, and glucocorticosteroid. Clear? I hope so. You have understood. If you are having any doubt, you can message me. For any of the doubt, you can message, you can ask. So you can prepare the notes, maintain the notes. Thank you everyone.